Hello guys, welcome back to our channel that is Homeopathic Trials. Today in this video we are going to understand symptom classification in detail, that is symptomatology. This is one of the most important topics of Organon, both from the practice as well as from the theory point of view. So do watch this video till the end and do not forget to like, share and subscribe to our channel and hit the bell icon to get notified about our content. So now without wasting time, let's begin. So before understanding the classification of symptoms, it is very important to understand what is exactly a symptom. Any change or deviation in the health of the organism which is either felt by the patient himself or which can be seen or remarked by the people around him or by the physician himself is known as a symptom. So whenever the vital force is deranged by any internal or external cause, it lets the world know of its derangement by the language of the symptoms, and so if symptoms are the language of the vital force, then for treating it, it becomes important to understand symptoms in detail. So in other words, symptoms are the only indications to choose the correct remedy. So now we will understand various types of symptoms one by one in detail. The first category of symptoms is complete and incomplete symptoms. So the concept of complete and incomplete symptom was given by Dr. Bonninghausen. So according to him, every symptom has following components. The first one is the location, which includes or denotes the part of the body or the function of the body where the symptom appears. The second one is the sensation, which explains the nature of the complaints or symptoms, example, burning, aching, throbbing, etc. The third part includes modality, that is circumstances under which the patient either feels better or feels worsened or aggravated of the complaints. And the fourth one is the concomitant. These are the symptoms which exactly do not have any pathological relation to the disease but always accompany the main symptom of the disease. So these symptoms were the first noticed by Dr. Bonninghausen and later became popular. So these are the basic components of any symptom, which the physician should inquire during the process of case taking. But when despite of inquiring properly, when in some cases the symptoms do not have the components of either modality or concomitants, then such symptoms are termed as incomplete symptoms, and if the symptom has all the previously mentioned four components, then such symptoms are known as complete symptoms. Example, coryza with headache aggravated by open air is a complete symptom as it has all the important components of a symptom, while just coryza without any modality or concomitant becomes an incomplete symptom. Next, we would try to understand the concept of subjective or objective symptoms. This concept of subjective or objective symptoms was actually given by Dr. Stuart. So, subjective symptoms are those symptoms which the patient feels or experiences himself and cannot be felt or seen by the physician. So the various sensations like burning, throbbing, or various physical general symptoms like desires, aversions, or mental symptoms like various emotions, example anger, sadness, indifference, or various dreams like dreams of flying, falling, etc., are all the examples of subjective symptoms. These symptoms are of extreme importance to the homeopathic physician as they are the very first signs of the deranged vital force. This is because whenever the vital force is affected by any external or internal causes, it tries to make the person realize of it by the means of subjective symptoms. And hence these symptoms help to select the remedy homeopathically and to individualize the case. While the objective symptoms are those symptoms which are seen or observed by the physician or by the patient and by his attendants. Hence these objective symptoms are also called as signs, which help us to diagnose the disease and are not very useful to select the remedy unless there is some characteristic thing noticed about them. These signs or objective symptoms are usually seen at later stages of the disease and often are the end products of the disease. However, such signs can prove useful for selection of the remedy in cases of infants, psychiatric cases, or in cases of unconscious patients where it becomes difficult to get subjective symptoms, or in the cases of severe pathological diseases where the main goal of treatment is palliation. Few examples of the objective symptoms can be Gray Turner sign or Cullen sign in the case of pancreatitis, etc. Next, let's have a look at the concept of common and characteristic symptoms. The concept of these symptoms was given by our master Samuel Hahnemann. This was mentioned by him in the aphorism 153, where he says that the symptoms which are striking, singular, uncommon, and peculiar are the chief and sole indications of the remedy, and such symptoms are known as characteristic symptoms, while the symptoms which are more general and undefined Example, loss of appetite, headache, debility or weakness, etc. are of lesser importance as these symptoms can be seen in all cases of that disease and such symptoms are called as common symptoms. This concept is most important aspect of the homeopathic prescribing, as for a good homeopathic prescription, the physician must have the great understanding of this concept of common and characteristic symptoms. So basically, characteristic symptoms are the symptoms which should be able to distinguish two cases of the same disease and they should be able to individualize the remedy as well as the patient. Example, headache in the frontal region aggravated by motion and better by absolute rest with great thirst for large quantities of water at large intervals is a characteristic symptom which is capable of distinguishing two cases of headaches as well as headaches of two remedies and is found only in bryonia. Thus, it becomes an important characteristic symptom. Also, while taking a case, the physician must keep in mind the circumstances of the patient as they make a symptom characteristic or common. For example, if in a case where the patient is feeling sad because of loss of any loved ones, then such symptoms becomes common. But if a patient feels sad because of some trivial or less important cause, then that definitely becomes characteristic. Next type of symptoms which we will study in detail is the keynote symptom or the pathognomic symptoms. Both these type of symptoms directly indicate something. Keynote symptoms are the symptom or set of symptoms which directly indicate a remedy or a very small group of remedies. This concept of symptom was given by Dr. Stuart. So example of a keynote symptom can be complaints caused by exposure to dry cold air with great fear and anxiety of mind is a keynote symptom of aconite, or jelly-like lumps of mucus in the stools or diarrhea aggravated immediately on waking up in the morning is a keynote of allosocotrins. So keynote symptoms are usually used a lot in prescribing by the well-known school of homeopathy, that is the Calcutta School of Homeopathy. It definitely reduces the time and the labor required by the homeopathic physician in the case-taking process. But using keynotes for prescription is not so easy, as using them without considering the other general symptoms of the remedy can mislead or can lead to wrong selection of the medicine and can further lead to failure of the case. Thus, they should be used to prescribe with complete knowledge of the keynote symptoms. So, pathognomic symptoms, on the other hand, are the type of symptoms which directly indicate a diagnosis. These symptoms form the basis of the diagnosis and thus they are of great help to the allopathic physicians in treatment, while to the homeopathic physician it can help only in the diagnosis part. Such symptoms are of use in selection of the remedy when they are qualified or accompanied with some characteristic modality or concomitant, or when the goal of the treatment is just palliation. So development of the Koplik spots in the measles or development of Kaiser-Fleischer rings in Wilson's disease are the examples of the pathognomic symptoms. Next, let's understand the concept of general and particular symptoms. So general symptoms are those type of symptoms which usually relate to the patient as a whole or relate to two or more than two systems of the body. Patient usually describes these symptoms referring to himself using the first personal pronoun, example, I am weak, I am thirsty, etc. The general symptoms are further divided into mental and physical general symptoms. All the mental symptoms are usually considered as mental general symptoms, while the physical general symptom is a symptom which refers to the entire body or function of the patient as a whole. These physical general symptoms might include various symptoms like general modalities, hunger or appetite, thirst, various body tendencies, example tendency to catch cold easily, etc., side affinities, constitutional tendencies, menstruation, discharges, periodicity, etc. This entire concept of general symptoms was given by Dr. Kent, and in the evaluation order, general symptoms top the order and always guide the selection of the remedy as these symptoms affect the entire person as a whole. While the particular symptoms are the type of symptoms which are related to a particular part or organ of the body. So example of the particular symptom can be headache, coryza, abdominal pain, ear pain, etc. These type of symptoms usually help in diagnosis rather than in selection of the remedy unless it is qualified or accompanied with some characteristic modality, sensation or concomitant, or the goal of the treatment is palliation. Now next type of symptoms which can be easily studied are clinical symptoms. This concept of clinical symptoms was given by Dr. Borick. Clinical symptoms are those symptoms which usually do not appear in the proving of the medicine but accidentally are repeated and repeatedly cured in multiple cases at a clinic. Example, pleurisy and pleural pain of bryonia were not at all marked in the proving, but were cured repeatedly in the patients of pleurisy when prescribed on other symptoms, and thus were later included in the materia medica of bryonia. These symptoms usually help a lot in prescribing in acute cases or in acute exacerbations of chronic diseases or in cases where the goal of treatment is palliation. And at the last, let's understand the concept of eliminative symptom. Eliminative symptom is a type of symptom which directly strikes out a remedy or group of remedies in the analysis of the case. This concept was established and was given to the field by Dr. Margaret Taylor. According to her, the totality of symptoms should be arranged in a way where the symptom which is most characteristic and cannot be excluded from the totality should be at the top, and then the medicine which doesn't cover the first symptom can be eliminated directly, and thus these symptoms are called as eliminative symptoms. So this was all about symptomatology, where we have tried to explain various concepts of different symptoms in detail. We hope that this video will help you a lot, and if you have liked this video, do like, share and subscribe to our channel and help us to reach more and more students as much as we can. Also do comment down your valuable feedback which would help us to improve our videos.